Hearing tells us a bit more about what's happening around in the world, and it begins when sound travels through the air in the form of sound waves and reaches our ear. Sounds are formed through vibrations at different frequencies or pitch, but it's not just our ears that we hear with. We actually hear with our brains. So I'm going to first have a look in your ears. I'm going to be using this light and looking in through. A hearing loss can be diagnosed through a comprehensive hearing test. In that, we start by looking into the ears, and that is just to see first if there are any blockages in the ears or any abnormalities. We then do a test of the middle ear or the eardrum to see how it responds to sound and if there's any signs of infection behind the eardrum. And lastly, you will then sit in a sound booth, or with a mobile diagnostic machine you would have sort of earmuffs over the ears, where you'd be listening to the sound and push a button each time you hear the sound or you think you hear the sound. And then we also check your ability to recognize words at different levels. We then show you on a graph that's called an audiogram exactly what your hearing levels are at and what the type and severity of hearing is. A hearing screening, though, is a quick 10 to 15 minute check of what your hearing levels are at. And then we are just doing an examination of the ears again, also a test of how well the middle ear or eardrum is moving. But the actual hearing screening only tests your response to sounds at half of the frequencies as compared to what we would do in a full diagnostic as well. When we talk about the benefits of going from a hearing screening, first of all, that tells whether you should have a full diagnostic hearing test done if there are any indications of cause of concern for your hearing health. A hearing diagnostic test will then indicate if you are a candidate for a hearing device like hearing aids itself too. A hearing screening should be done at least once a year. And when we talk about hearing screenings from the younger population, in South Africa, babies are screened for their hearing as well before they're discharged from hospitals. And in schools, all the way up until grade 7, a hearing screening should be done and too.